Tatanastata kunnistle. Nanastatle the province said the Gornako. Welcome to my territory. This land was dedicated to us when we came to the plains by the Blackfoot people. And we've been here since the arrival of the horse to the plains. So if it causes you problems, that's from an elder. Over the years, we've been at odds with the province for many things. But this is the first time that the province has actually put out a hand and start helping the different First Nations in a real effort for the truth and reconciliation. And I really am proud to be a part of it. I thought I'll never see it. Let's agree to disagree, but let's agree to help one another as our populations grow. So they asked me if I wanted to turn the cameras off when I pray. I said, no. Keep them on, because we need the words to live on after we're gone. Right now, we're building up a database with the University of Alberta, the University of the Carleton University, and our other partners. So if you can send me the prayer that I'm going to say today, I'd appreciate it for our database. Ayahonata, nakatanan is anata natishawa, kukulinata atiwasa, the province of Alberta is silanatakot ine hakut aakula, kuja etlok anakot inakula. Adinaha chief, chakoja ka weaselfoot, or dinikache chief Crowfoot. Adina Sakams is and other chiefs that are here. Diek ahle nacha nanit datle Sakams is Adide kuchakula nata. Wusa erjikun shahat on the sita, Adinas is Kokolina dide di COVID, Nahas the highest tane. Nihikahas te hanelaha. Nahata gut anata. Tlata chutina. Tlata gache tej das kaninishina. Tlata nahata gut a di sunina tanis tanisila. Nakatananis ina detenas sititenina. Okolina nihiska kachunitsana kakasku takiminitana nata. Hat ayinisen, hat anitsiskat.
Thank you, Elder. See us, Gus. He's trying to teach me a little bit of language. The language is so important when I go across the province, whether it's Dene, Cree, the Blackfoot, Tsuut'ina, Stoney Nakoda. To maintain the language is so important, and we really appreciate that. That's why we worked with the Kainai for the Red Crow College, and part of that's going to be preserving the language. So thank you, Elder. Thank you for sharing that prayer with us on live. That's a special one for me. Again, good morning, everyone, and welcome. We have many chiefs here. Welcome, chiefs, council members, my fellow minister, Tyler Shandro, special guests, and dignitaries. Let me thank Elder Starlight one more time for that blessing to get us off on a meaningful start. See us, Goss. I'm Rick Wilson. I'm the Minister of Indigenous Relations, and it's an honor to be here on Treaty 7 on the territory of Tsuut'ina Nation. I also want to thank Chief Roy Whitney, One Spot, for hosting today's announcement. I've got to know the chief over the while, and he's a great chief and doing a lot of good stuff for his people. Just a month ago, the Premier Kenny and I were here at Tsuut'ina with Chief Whitney and the chiefs of the Stoney Nakoda Tsuut'ina Tribal Council to sign a special agreement between our governments. And what a special day that was. They actually laser etched a buffalo hide with the agreement on it, and we signed that, and we'll be hanging that proudly in the legislature. It confirms our strong relationship to work together in ways that make our communities better. And the elder asked me today, when I asked him to pray for us, he says, why would I do that? And I says, my job, and I've taken this seriously, is to work to make Indigenous lives better. And that's my main focus. And we want to work with reliable social and economic supports. Economic opportunity is the backbone of a strong and vital communities that foster a sense of well-being and belonging. Through innovative partnerships and in the spirit of reconciliation, Alberta's government is removing barriers to prosperity for Indigenous peoples. We're working together as partners to ensure that Indigenous communities have access to economic development opportunities to support strong economic and community development. That's why we created the Alberta Indigenous Opportunities Corporation. The AIOC makes it easier for Indigenous communities to access financing to invest in major resource development projects. We've kicked off our first project already with Cascade Power, 6 First Nations involved, a $1.5 billion project using Alberta's clean natural gas to produce power for Albertans. Over 8% of Alberta's power is going to be produced from that. We also developed a litigation fund to support Indigenous communities that want to stand up to federal legislation that hinders responsible resource development. And government the site rehabilitation program for the well sites all across Alberta includes initiatives to support Indigenous participation in business and land remediation, all while getting people back to work. Between the 2 projects I've just announced, that's over 1,000 jobs, thousands of jobs actually in the site rehabilitation program. Each of these initiatives helps to launch new revenue streams for Indigenous communities. Revenues that are going to boost their local economies, gets their young people working, and support community services and programs. Sustainable and diverse economies give rise to strong communities. And that's why today I'm happy to celebrate another important initiative that explores how 6 First Nations can play a role in strengthening Alberta's health system. Now I'd like to invite our Minister of, Tyler Shandro, Minister of Health, to make today's announcement.
Well, thank you, Minister Wilson. And thank you as well to Elder Starlight for the opening prayer and the warm welcome. As he said, I think it's fantastic that we can agree to agree, and that we can work together with our First Nations and our Indigenous communities to improve access to our Indigenous communities to healthcare. We can improve their health outcomes for the Indigenous people of this province, and as well that we can improve the way that our First Nations can participate in the delivery of healthcare throughout the province. And as Minister Wilson, thanks as well to Chief Roy Whitney, One Spot, for and to all the leaders and members of the Tsuut'ina Nation for hosting us here today. I'm honored to be here on Treaty 7 land to celebrate the strong partnerships and the innovative work between government and First Nations to improve health services in our province. I'd also like to extend a warm welcome to Chief Crowfoot from the Siksika Nation. I'm so pleased that 6 First Nations, representing all 3 treaty areas in Alberta, have stepped forward to explore the potential to help reduce wait times for surgeries here in Alberta. The Alberta government has provided $50,000 each to the Tsuut'ina Nation, Siksika, the Blood Tribe, Enoch Cree Nation, Maskwacis Bands, and Big Stone Cree Nation. These grants will support each First Nation to complete a business case to determine if their community could build and operate a chartered health facility. or chartered surgical facilities, sorry. We want to make sure that each of these First Nations have an opportunity to support us as we move forward with our promise to Albertans to make sure that all scheduled surgeries are done within a clinically appropriate time. And these grants will help First Nations secure the expertise that they need to help position them to compete for contracts with Alberta Health Services to offer publicly funded surgeries. AHS will post the first formal request for proposals for chartered surgical facilities before the end of the year. And that's exciting and vital work. And as I've said before, that's my #1 job, to get surgical wait times down so that everyone can have their cataracts removed or their knee or hip replaced within clinically recommended times by the year 2023. These surgeries are often called elective surgeries, but they're certainly not elective. They're not optional at all for the people who are waiting in pain with decreased mobility, impaired vision, or other issues. We have to fix this problem and give every patient the care that they need when they need it. And that's why I'm so pleased that the First Nations and other innovative thinkers have come forward to work with us to be part of the solution here in Alberta. And with the COVID-19 pandemic fundamentally changing our world and how we live today and into the foreseeable future, we need to work extra hard to make sure that our surgical system here in Alberta is the best in the country. AHS is already ramping up the numbers of surgeries to reduce the backlog created this spring by the pandemic. They worked incredibly hard to relaunch the health system on May 4th, and working since May 4th to get the province to 100% of our pre-COVID surgical capacity. Now, not every zone is at 100%, and we do have issues right now with capacity in the Edmonton zone, where we have had to unfortunately postpone some scheduled surgeries again. But their goal in AHS is to be back up to pre-pandemic levels as soon as possible, and to continue to increase our surgical capacity well into the future to be able to meet our commitments to Albertans by the year 2023. And so by next summer, AHS hopes, for example, to be performing surgeries up to 150% of their pre-COVID capacity. Now, that's all subject, as I said, to the pressures that the pandemic may impose on our hospitals and impose on our staff and our beds in the weeks and months ahead. But overall, we're adding thousands more surgeries, and that includes more work in hospitals, in new and expanded operating rooms in AHS facilities, during the evenings and weekends as well, so we're expanding the amount of time that surgeries are being done in our publicly owned hospitals, and building capacity in our chartered surgical facilities to provide less complex surgeries. We need them to help us deliver on our promise to Albertans. And these chartered surgical facilities would offer thousands more surgeries at lower cost to Alberta at no cost to patients. The Alberta Surgical Initiative also ensures First Nations have a role in strengthening healthcare in our province and sharing in the economic growth. And so I'm honored to be here and to work with Tsuut'ina and Blood Tribe, Enoch, Big Stone Cree, Maskwacis, and Siksika to explore options in reducing the wait times here in Alberta. Together, we can build the best surgical system in the country. And together, we can do this important work while also facing the ongoing COVID-19 pandemic. These are challenging times, but I know that we, as Alberta, are up to the challenge. We must continue to remain vigilant, to practice physical distancing and wash our hands regularly so that we can keep our families healthy and keep our healthcare workers and the entire health system healthy, to provide healthcare to everyone who needs it here in Alberta. And so thank you very much for joining us today and for allowing me to speak. And I'd like now to invite Chief Whitney Onespot to share what Tsuut'ina Nation has in mind for this important work ahead. Thank you, Chief.
Good afternoon. It's a pleasure to be here with both ministers. And this important announcement, Minister Shandro, in regards to facilities that will enhance not only our communities but our surrounding communities, and assisting them to ensure that the health care that's going to be required for individuals can be facilitated. I want to thank Chief Crowfoot for being here with us today, Maskwacis, First Nation, I appreciate you joining us. And I'm pleased to join the minister and the fellow chiefs in the announcement to further explore the development of healthcare facilities on Indigenous lands in partnership with the provincial government. One of my long-term goals for the Tsuut'ina Nation and the Council's long-term goals, along with our health workers, is to continue to build along not only Tsuut'ina lands, but the lands, all lands at Tsuut'ina, but in partnership with TAZA, to offer health services and health facilities and learning opportunities for our nation members. As we consider this particular initiative, I saw the opportunity for our nation's youth to be trained and to find work as health professionals alongside professionals from Calgary and surrounding areas with facilities on our nation. Our youth will be mentored and in turn mentor future members of the Tsuut'ina Nation, all while providing a valuable service to communities. And I see this creating better and more easily accessible care for our nation members, but as well as for our relatives around and the people from the city of Calgary. Finally, I see this as part of our nation's plan to build and manage our future in healthcare. So to you, Minister Honorable Shandro, and to your colleagues, Minister Wilson, and your colleagues in government and the Premier, thank you very much for this opportunity for First Nations to participate in the development of care for First Nations people, but as well as working in partnership with our friends from the City of Calgary. Thank you very much.
Thank you, Chief. It's an honor to be here with you today again, like I said, and great work, Minister Shandro, on putting this together. This is an awesome thing for all Indigenous people. So we're going to invite questions now, and no, Chief. Oh, sorry. Oh my God, I'm going to be in big trouble. Chief Crowfoot is going to join us here now. Okay, Chief. Okay. Sugapi.
Not Sugapi.
Not Sugapi. Nisto Sugapi.
Okay. My name is Ori Crowfoot. Nukshkestamik is my Blackfoot name. That means three bulls. I'm here on behalf of Siksika Nation. I'd like to thank the elder for the blessing today. There's a lot of relations between Siksika and Tsuut'ina. I have some cousins that are on Tsuut'ina's council. So I'd like to also thank Minister Shandro. I would like to thank Minister, what was your name again? Well, Wilson for I don't know. But anyway, nonetheless, it's a good day to be here. When we support the Alberta Surgical Wait Times Initiatives, it offers great promise for Alberta. And I'd like to extend great gratitude for this opportunity to participate. The initiative is a next step of many necessary steps towards equitable access to appropriate health care services within responsible time frames. As Chief of Siksika, I have the utmost confidence in our Siksika Health Services Department and team. For nearly 30 years, Siksika Health Services has offered holistic health care services to Siksika Nation and surrounding communities. With each year that passes, programs and services are enhanced to best meet the needs and priorities of Siksika members and for all Albertans who access our services. Never before has our health services team been put to such a test as we have amidst this COVID-19 pandemic. But they have risen to the occasion and provided comprehensive health care services to our community and well beyond. Building upon this foundation, it is with confidence and gratitude that we will support and participate in Alberta's Surgical Wait Time Initiative, not just for our own people, but for the benefit of all living in Alberta. First Nations make excellent partners in healthcare, with a focus on providing holistic care and draw from our traditional models of wellness and cultural values to promote strength and resilience for our people. By taking part in opportunities such as this, it gives us a tool to move forward for future generations in mind. Together, we will accomplish the collective goal of health equity. And again, Minister Shandro, I'd like to thank you for inviting us out. We too, the Blackfoot Confederacy, signed the protocol agreement that Minister Wilson just mentioned, but we have not seen some of the fruits from that protocol agreement. We hope yours is not just a bureaucratic exercise, but you actually get some good benefits from it. So we also are very optimistic about this as well. So we're looking forward to the opportunities, and we thank you at this time. Thank you.
Okay. Did the Musqueam people want to speak? No? I don't want to get in trouble again. Thank you, Chief Crowfoot. It's always an honor. And we did have the honor of signing the protocol agreement with the Blackfoot Confederacy as well. And it's an honor to have you here and all of the chiefs with us today. We are going to take some questions, so we're ready for that if you want.
Excellent. Could the operator put through the first call?
First question at this time is Kevin Nimick with CTV. Go ahead, please, Kevin.
Hi, this is a question for Minister Shandro. How many FTE hours of contact tracing work is the province paying for every week? And when will we see those 350 new postings be filled?
Thank you, Kevin. So right now it's over 800. I think it's 829 that we have right now for our contact tracers in the province. For the ones that we are trying to fill, I'm not sure when those will be. I know that we're doing our best to hire and train as many contact tracers as we can. I think I've mentioned before that there's 3 different levels of contact tracers, all requiring different levels of expertise. So some of it does depend on which of the 3 levels somebody might be applying for and how much training is required for a new contact tracer to be trued up for that. So we're working hard with AHS to make sure that resources isn't an issue for them, and that we're going to continue to work with them to make sure that we continue to hire and train as many contact tracers as we're going to need throughout the winter.
If I may follow up, why have resources become, because a lot of students were providing contact tracing services and then they went back to classroom activities, or what created this gap in contact tracers?
No, resources are not an issue, as I said. Sorry, you may have misheard. It's the opposite. Resources is not an issue for our response to the pandemic at all for AHS. Look, starting in March, the entire health system did pivot to focusing on COVID. So everybody throughout the system was helping us with our testing, with our contact tracing, with our assessment centers, folks who were helping out in the labs. Once we relaunched the health system on May 4th, a lot of those folks did go back to work, and that's why we worked with AHS to make sure we went from 50 contact tracers to over 800. And saying that to AHS, we're going to continue to work with them on making sure we continue to hire and train contact tracers. Thank you, Kevin.
Thank you very much. This concludes today's announcement.
I just said thank you again for coming, everyone, and thank you to the chiefs for joining us today and for letting us use this wonderful facility. Thank you.